dangerous drugs, injuries, and abuse. Across the state of Alabama, the attorneys, proudly sponsored by Hollis, Wright, and Couch, are here to serve you. Your tough legal questions answered by our experts. The attorneys with Josh Wright from the Hollis, Wright, and Couch Law Firm and host David Lamb.
Hello and welcome into the attorneys. Appreciate you spending your Sunday evening with us. Our whole plan here for the next half hour is to answer your tough legal questions. So throughout the show, you will see ways for you to call, text, email. We would love to get your questions, and we're going to do our very best to answer every question you may have. We're joined from the firm of Hollis, Wright, and Couch by Mr. Steve Couch. Good to see you, sir.
Good to see you, Dave. Good week.
Yeah, good week indeed. I hope you did as well.
Did fine.
An interesting show tonight.
Yeah.
Right out of the headlines, this one is.
Yeah, this is a great show, and I'm so excited that we're doing it. We're talking about concussions tonight, and you know, candidly, until my kids started playing sports, I didn't really give this much thought.
Right.
And you know, the more head injury cases that we started doing, and that I started doing, and the more my kids got involved in sports, the more I started studying this and realized the seriousness of this. And you know, David, we don't just bring anybody on this show tonight. We're honored to have as a guest Dr. Emily Bell Casey. She's from Andrews Sports Medicine and Orthopedic Center. Dr. Casey is a board-certified primary care sports medicine doctor, and she's also board-certified in internal medicine. Thank you so much for coming on and talking with us tonight.
Thank you for having me.
Well, we appreciate it and looking forward to the next half hour. Hopefully you can shine some light, like Steve was saying, you know, something that we're hearing a whole lot about now. How about if we start just with the basics? Help us understand what exactly is a concussion.
Well, a concussion is an injury to the brain. We also call it mild traumatic brain injury. It occurs when you've had a jolt or a blow to the head in football, of course. That's one of our contact sports. That's helmet to helmet, helmet to the ground. It does cause impaired brain function, but if diagnosed and treated properly, you can recover from a concussion.
Yeah. Dr. Casey, by the way, is a team doctor, are you not, for several high schools and colleges?
Yes, I am.
Is that true nowadays, that most of the time there's doctors or folks on the sidelines to help out and to look at injuries or blows or anything like that?
Yes, there is. You know, most high schools at least have an athletic trainer, a certified athletic trainer that are trained in sports injuries and concussions. And also nowadays our coaches, if they don't have an athletic trainer that's there, they are getting training on these things too. But a lot of the schools do have team physicians on the sidelines.
Has it been your experience that the awareness much higher now than it was just a handful of years ago? These certainly, if you watch the news and you watch sports, there's such an awareness. There's that constant discussion about concussions, the impact of concussions. Has that trickled down to the local level, local high schools as well?
Definitely. Of course, if they're making changes in the NFL and then in college, now we're seeing those in high school and in our youth sports also. We're understanding concussions better. There's still a lot to learn. But we know that, you know, again, if they're treated, they can be, there's ways we can prevent it, but they can be treated. But if you don't catch them, they can have some long-lasting effects. You're
talking about prevention. Athletes, I mean, they have pads everywhere. They have a helmet that's specifically designed for a contact sport. How can athletes prevent themselves? What are some steps other than just quitting playing altogether?
Well, number one, the NFL, NCAA, High School Association, a lot of medical teams are getting together and, of course, making rule changes to make the game safer in contact sports. You know, you have the kickoff rule changes, illegal hits, things like that. Also, equipment is important. You know, mouthpieces are important for mouth and teeth injuries. Helmets are important and do help prevent head injuries, but at this point, there is not a helmet that is 100% effective to always prevent a concussion. So, and the other thing is education, what we're doing here, knowing what to look for, what an athlete may be feeling, and educating at the athlete level. They need to know what to look for.
Yeah. So, all right, so let's break it down to an instant. At a ball game, an athlete takes a hard hit and appears to have suffered a concussion. Either they're knocked out, I guess that's a sign. I mean, if there's concern or fear that the athlete may have suffered a concussion, what should the athlete and also the coaches, what should happen next?
Well, number one, they're removed from the game, and again, that's why the education is important. If doctors on the sideline, who's watching the game? Did you see a hit? Are they getting up and staggering or walking to the other sideline? Are the other players coming to the sideline and telling you, hey, my teammate isn't acting right? So first, you've got to, yes, recognize it. If there's anything that gives you suspicion for it, they're out of the game, and the law states that they will not return. If it is a concussion or worry for it, they will not return to the game that day. Okay. We also start testing on the sidelines. We'll, check, are you alert and oriented? There's a sort of certain questions we'll ask. We'll do neurologic exam. There is a test called the SCAT-2, Sideline Concussion Assessment Tool, that's very handy to ask what are your symptoms, check balance, check memory, thinking questions that we can use to also help the coach or the athletic trainer decide that this is a concussion.
Mm-hmm. Is there much of a difference? You see it when you watch football and the hard hit, and there experts there to see that. Is there much difference whenever I'm my wife opens a cabinet and I don't know it, and then I pull up and hit my the back of my head, and then I feel dizzy for a second? Is that kind of for the rest of us who are not elite athletes? I mean, are those the symptoms I need to look for? Could that be a concussion too? Yes.
Symptoms of concussion, whether it's in contact sports or a car wreck, or you hit your head in the kitchen or your child falls off the bed, right. You're looking for headache, nausea, vomiting, dizziness. They seem very lethargic and sleepy to you. They have memory issues. Maybe they can't remember their address or where they're playing that night. Right. Balance testing. So there's a lot of signs and symptoms that we look for, and if you have those symptoms, you have a concussion.
Yeah. In fact, concussions. We're doing this show kind of in the context of sports, and I understand that, but it's amazing because concussions can happen whether you fall down, you're in an automobile accident, etc. And if the serious ones are repeat ones, and I'll let you talk about the medicine behind that later on, but they can be devastating to somebody. And so you got to be mindful, and you have to be vigilant, know the signs that Dr. Casey described and others, to be aware of this, because compound concussions, and I do want to get into that later on, they can have a devastating effect, have had a devastating effect to a number of people, and in fact have led to the enactment of Alabama's law with respect to athletes in high school, et cetera, and having to be removed from the game. I can talk about that, or want to? Governor Bentley, a couple years ago, adopted Alabama's the law that you're talking about. It grew out of a Joshua Lystead incident. I don't know if you heard about this. The kid 13-year-old kid up in Seattle, he was playing football. He took a hit on the head. It looked like an innocuous tackle. You can see it on YouTube if you go there. Right. He was taken out for 3 plays, put back in, he took another hit, passed out, taken to the hospital, and it was just devastating. I mean, that young man, it took him 3 years to learn how to talk and walk again. I mean, it was just horrible. And the NFL got behind Joshua, started enacting all these laws throughout the country, and I think last time I checked, maybe there's 30 states that have adopted it, Alabama probably being the most recent, that requires athletes, if there's a suspicion of a concussion, they must be removed from the game, and that's what Dr. Casey was talking about earlier.
Dr. Andrews at the absolute forefront. I mean, what a respected name globally. Does your practice, does it have a position in terms of, can we be doing more? Should high schools, should NFL, should colleges be doing more? From more of the legislative standpoint of prevention and doing what we can to help in the cause of concussions and to help the athletes?
Well, I think we are, and I think as sports medicine physicians in all levels, from NFL to college to high school, we do help make an impact as the physicians and in the medical side of this. And so, there's a lot to still learn, and like you said earlier, we've come a long way over the past 5 years. People don't go back into the game now. So I do think that we are, and we can, and there's a lot more to learn, and at least we in our group, we have access to a lot of those different levels, so we can help make a difference.
Yeah, certainly. I know you all are at the table when those discussions are taking place, and thankfully so. Time for our first break. As we head to break, a reminder, we welcome your input here. You can call, text, email the show. We'd love to hear from you. We'll take your questions to our panel of experts, so get in touch with us. Stay tuned. The attorney's coming right back.
I'm Josh Wright with the law firm of Hollis, Wright & Couch, and thanks for watching The Attorneys on Alabama's 13. Now, we hope you, a friend, or a loved one never need legal counsel for a case. But if you do, the goal of the show is simple. Provide answers and legal counsel when you need it the most. Your call to the show is free, so if you have questions specific to this show or related to other civil legal matters, call, email, or text us to talk with one of our lawyers. You can also follow us on Facebook or Twitter to learn about important legal news that could affect you or your family. Or simply contact us by going to alabamas13.com and click on the Attorneys link. We know your time is valuable, so thank you for spending it with us and for watching The Attorneys right here on Alabama's 13.
Women's ice hockey. That surprising. When in doubt, sit them out. Good piece of advice. We're talking about athletes and concussions. As we do so, welcome your input. You can call, text, or email, and we'll take your questions to the panel of experts that we have. Let me ask you, oftentimes folks think whenever a sign of concussion is being knocked out cold, okay, that's kind of a clear sign. Do you have to lose consciousness to have a concussion?
You do not, and actually the majority of concussions, people do not lose consciousness. Again, they either have a major hit and you see them getting up from the ground slowly, or multiple hits and they start having a headache. So it's more looking at the symptoms of headache and those other things we talked about. You do not have to lose consciousness to have a concussion. You
know, Dr. Casey, I had some clients talking to me several weeks ago, and their son took a hit in a football game. They said their son felt fine afterwards, but just to be vigilant, they took him to the emergency room. And she was asking me about the emergency room visit. She said they did an exam, asked him some questions, said he couldn't play for a week, and she was wondering why they didn't do any x-rays. Can you talk to us a little bit about those objective tests out there and what, if anything, they can show if somebody has a concussion?
Yes, so again with concussions, you know, it's not like where you break your arm and you take an x-ray and you're ruling in and out a fracture. With concussions, again, it's more of looking at that brain function, looking at your symptoms, emotional state, how are you sleeping, balance testing, memory, cognitive. The majority of concussions do not need a scan, a CAT scan or MRI. They're going to be normal. Now, if you do have loss of consciousness, increased vomiting, increased headache, anything that's worsening, pupils are not equal or reactive, you should have a CAT scan or an MRI done to rule out intracranial bleed or anything more going on in the brain. So if you look, a lot of times we don't always scan people unless those concerns are there.
Okay. As I understand it, concussion is a bruise to the brain, or am I simplifying? Am I oversimplifying that?
It's kind of simplified, but that is a good way to explain it, a bruise to the brain. If you think about the skull, and there's fluid in the skull, and the brain is sitting in that fluid, and so when you have a hit to the brain, it is shaken. There's not necessarily a structural, but more of a impairment to function.
Okay.
You know, oftentimes when you're watching sports and you hear of an athlete who suffered a concussion, there can be such a difference in how different individuals are affected. Some folks can take a hit and they miss a game and they're back and never a sign again of any problem. Other athletes can miss weeks of playing. Well, what is up with the differences in kind of the effects of those, or the speed of the recovery, maybe?
Well, for myself, each case is different. Each athlete is different. Each hit is different. You know, did they lose consciousness? Did they have a concussion a year ago or 3 months ago? Is this their first one? So each case is different as to how someone may respond to the concussion or what their symptoms may be, and how long they'll recover. I also also think, again, you know, if you've had concussions before, if they were more recent, you know, could you get one sooner or easier? It all depends on how well you recovered before you got back to play. Yeah. So those are some of the reasons why. There's also things to think about, underlying conditions, migraines, ADHD. Those are problems with headaches and sensitivity to light and concentration. So sometimes they interfere with healing from a concussion and to tease out between the concussion and those other problems.
I wanted to ask this because I was talking about boxing the other day with somebody, and I was wondering, does somebody ever fully recover from a concussion? I mean, and if so, I assume different people are different. I mean, does somebody fully recover from that? And when they do, can they take another hit? The reason I ask is because, you know, some of the boxers that I've seen interviewed, they appear to, some of them have some neurological impairments, speech impediments, and that type of thing. And I'm wondering, you know, can somebody fully recover, and if that can happen, can they then safely get back into the ring? What's the likelihood of having another concussion after you've had a first one? Can you kind of speak to those things?
Well, I do think you can fully recover from a concussion. I mean, we see kids every day in the office. We treat them. We, you know, have them safely return back to sports and have, you know, do good in school and graduate and go on to be, you know, productive and have a great career. But I do think, again, there's still a lot to learn about someone in a profession of boxing or the NFL where they're having the risk of multiple concussions, and when is enough. And, you know, one thing is not returning to the game before you've completely recovered from one concussion. There isn't one test out there that really says, you know, you are 100%, you're you know, not going to have another concussion. That's why we have to look at these tests, whether it's the SCAT2 or these neuropsych tests that we can do online and computerized. You put all of that information together and make the best medical decision. If you're symptom-free and you're playing again and you're in contact practice and having no problems, you're doing well in school or at work, you know, and you're back to normal function, then we feel that yes, you've recovered from the concussion. But there's still a lot to learn about, you know, 2 concussions, 3 concussions, how closely they're together also.
Questions here that we have: after you receive a concussion, when is it safe to play sports again?
Good question. So first of all, we number one want them to be symptom free, and we usually say 24 hours. Okay. 24 hours of symptom free. That means I didn't need Tylenol for a headache. I felt good. I've had no headache, no dizziness. My parents, my friends say I'm acting like myself again. I can concentrate in school. I can go to work with no problem. So when you're symptom free for 24 hours, then we feel that it's safe to, at least in sports, start a return to play program. And number one, that would be you do on day 1 about 10 minutes of some light cardio. If you have no symptoms, we'll go to day 2. You'll do sports specific drills. On day 3, you'll do non-contact practice. And on day 4, we'll have you in contact practice. Each day, if you have remained symptom free, feeling great, then we'll get you back into sports. But if you have symptoms, you must report them so that then we can pull you back out of the game.
So that's the medical clearance that you kind of hear about. That's the process?
Yes, that's the process. That's our return to play protocol.
Yeah. Okay. All right, time for our second break. As we head to break, want to remind you, get in touch with us, call, text, email. We'd love to hear from you. More of The Attorney is coming right up.
I'm Josh Wright with the law firm of Hollis, Wright & Couch, and if you've ever served on a jury, you may have wondered why there are gaps in the evidence you're given. In tonight's Legal 411, we're answering the question, is there insurance to pay the verdict awarded? Know this, just because the lawyers never mention insurance in trial doesn't mean there is not insurance to pay a verdict. Rule 411 of the Alabama Rules of Evidence states this: evidence that a person was or was not insured against liability is generally not admissible or allowed to be discussed at trial in front of the jury. The reason for the rule is simple. A jury could award more money in a case if they knew the defendant had insurance to pay for it. But the reality in our state is this: in almost all lawsuits that get to trial, insurance is there to pay judgments awarded by the jury. For example, all automobiles in Alabama are required to have liability insurance. Coverage can range from $25,000 up to $1 million. So in theory, all car crash cases that get to trial should have insurance available to pay any verdict awarded by the jury. Trucks have to carry as much as $750,000 up to $5 million worth of insurance. Unfortunately, you'll never hear that during trial because the rules just don't allow it. And even in medical malpractice cases, the doctor or medical professional has liability insurance to help pay a judgment. That's something you won't hear during trial because the rules generally don't allow such testimony. Yet almost all judgments against the medical professional involve liability insurance. Please remember, your call, email, or text to the attorneys is free. All of us at Hollis, Wright & Couch want to help answer your questions on real issues you face. Remember, a competent lawyer will respond to every question you send in. That's our pledge and promise to you. And as always, thanks for watching The Attorneys right here on Alabama's 13.
Talking about that just a bit early there, the Lysted and that impact of that injury on this whole discussion of concussions and athletes. Enjoying our time with Dr. Emily Bell-Casey of the Andrews Sports Medicine, and also Steve Couch of the firm Hollis, Wright & Couch. Got a few minutes left, but some interesting stuff here we're covering and learning.
Yeah, just seeing that factoid up there, I'd like to ask you, Dr. Casey, can you talk about the phenomenon of receiving a concussion on top of another concussion? Can it happen, and can you kind of talk about that?
Yes, and that is, again, why this show is so important, and other things to educate athletes and parents and coaches. So if you do return to play before you've completely recovered from your first concussion, number one, it could just make your symptoms worse. It could just make your concussion last longer, but it can even be fatal. There are very few reports of this, but there is something called a second impact syndrome, where you've taken a hit, you have a concussion, you go back into the game and you receive another blow to the head that could cause brain swelling. Then the vessels in the brain can't regulate the pressure, so there's increased pressure, increased cranial pressure, and then brain herniation and death. So I do tell my athletes and my parents, please be honest with yourself and with you. If you still have symptoms, let us know. If you haven't passed my test correctly, you're not going back to play. If we do our return to protocol and anything doesn't seem right, you need to let us know.
Right. What can parents do, or is there any sources they can go to read more about concussions if they want to do so?
The CDC has also partnered with all the different athletic organizations, and they have a lot of information on their website. They have what is a concussion, what signs to look for, a lot of statistics on there. They also have the return to play protocol. They have a lot of handouts for players, for coaches, and for physicians even to put in their office. There's a lot of information there.
That kind of goes right to a question that we have. My son plays high school football, daughter plays high school soccer. How should I go about raising concussion awareness in my community so that I can help keep my children healthy while still allowing them to play sports?
Well, I do think it's important to be active and healthy and play sports, and some sports have higher risk for head injuries. So, if you're going to participate in those sports, again, be involved, go to the PTO meetings, at the meetings before football season starts. Talk about, if they're not giving handouts about concussions to the players and the parents, that's something to do. Put that in your packet that you're going to sign up for sports. Make the parents sign it and hand it back to you, that they understand. I mean, I think it's even more important for an athlete, a high school or middle school kid, to understand, my head hurts, this is not normal.
Yeah. And that's a good point. Not only educate the coaching staff, educate your child, so they know what to work for. Another question here, is it true that sustaining multiple concussions can cause depression later in life, or even cause someone to commit suicide?
Well, that's still up for medical debate. There's a lot, again, I said that, we've learned with concussions and have come a long way on our treatment and our recommendations. And I think there's a lot to still learn, and that we can hopefully do and prevent and treat concussions even better. a concussion by itself can be recognized and treated and safely returned back to a normal life. Depression can be recognized and treated, but if they are unrecognized and not treated, they can have catastrophic events. Right. And again, that also goes back to, you know, are there any underlying problems like depression, you know, migraines, you know, other things, drugs and alcohol, that might make those things together lead to a bad outcome.
Let me ask you this, because I know that you're a team doctor for various sports, and we've been talking a lot about football tonight. What have you seen the other sporting activities, gymnastics, etc.? What are any of those events or sports or folks who run them? What are they doing, if anything, to try to educate themselves about concussions or try to prevent them?
Well, you know, of course, the biggest topic is football, because that is our biggest contact sport with collisions. Next would be soccer, even women's soccer. Mm-hmm. So we're looking at why are they getting more concussions, say in women's soccer, you know, is it head to ball ratio, their weaknesses in the neck that we can change their training. In gymnastics, again, I think it's just educating the athlete, mm-hmm. the coaches and the trainers, safer mats, safer techniques. Just like in football, safe hits.
Right, yeah. 15 seconds from each of you, just real quick. Final thought, final comment you want to pass on to the viewers?
I want to pass on that, you know, concussions are serious and they do happen, and so please, if you even suspect that you have a concussion or headache, get medical treatment so that we can safely treat you and have you here.
Good stuff.
I just echo what Dr. Casey said. I mean, educate yourself about it, and if your child is participating in any sports, make sure that their coaches and trainers know about concussions. Just ask them.
Information is important. Dr. Emily Bell Casey, thanks so much for your time. Steve Couch, good to see you as well. We're out of time, but we're going to be back here next week as we wrap up for a week. Ways that you can get in touch with the firm of Hollis, Wright & Couch. You can also find them on Facebook.
Thanks for watching The Attorneys, sponsored by the law firm of Hollis, Wright & Couch.